Today's data shows that 460,437 tests for coronavirus have now been carried out across Great Britain, including 21,389 tests carried out yesterday. 114,217 people have tested positive. That's an increase of 5,526 cases since yesterday. 17,759 people are currently in hospital with coronavirus in Great Britain, down from 18,711 yesterday. And sadly, of those hospitalized with the virus, 15,464 have now died. That's an increase of 888 fatalities since yesterday. At the beginning of this emergency, I told local councils that we would give them the resources that they need to do the job, and I meant it. And that's why today I'm providing an additional £1.6 billion of new funding to support councils with the pressures that they face as they respond to COVID-19. This funding takes the total amount given to councils to help them through the pandemic to over £3.2 billion. We are backing councils to ensure vital services such as adult social care, children's services, support for the most vulnerable, and waste collection continue despite the increased pressures. We're also helping councils with the inevitable cash flow challenges by deferring £2.6 billion in business rates payments to central government and paying them £850 million in social care grants upfront this month. Working with councils and charities, we've made huge progress in protecting the most vulnerable during this national emergency. Our plan to shield the most clinically vulnerable people has progressed well. 3 weeks ago, I reported at this press conference that the first government-organised boxes of supplies had been delivered by wholesalers to those at the highest clinical risk across the country. Today, 250,000 have been delivered. The packages include cereal, fruit, tinned goods, tea bags, biscuits, toiletries, and other essentials. And this coming week, we expect to be delivering 300,000 boxes, all from a standing start just a few weeks ago.
Testing is expanding all the time, and we are seeing a stabilisation in the number of tests that are coming back positive. We're not seeing a growth, and of course in the context of an increasing number of tests. The next chart shows how that is translating into hospital admissions, and I think it is now becoming clear that we are beginning to see reductions in the number of people with COVID-19 in hospitals. You can see that in London, that we have now had a succession of days where those numbers are decreasing, but also some signs in other regions such as the Midlands. So encouraging, but still early. We are still in a situation where, in order to continue to see these declines, it is critical that we all comply with the social distancing measures that we have been instructed to take. And then finally, on the last slide, as we've often said, unfortunately, a reduction in the number of deaths will be the last thing that will change. But if we continue to comply with instructions, it will change. Here we are now presenting death data for hospitals. The hospital data comes rapidly. We can get that very quickly, and therefore it's right that that is published immediately. But we can also collect data on deaths in the community, and now you will see a second line with some lag on it, which we are working hard to decrease the lag, looking at deaths in all settings.
Nobody wants to see people having to go to work on the front line to do that work, concerned that they don't have the protective equipment that they need and deserve, or coming home from work worried about whether there will be equipment available to them tomorrow. We've got to do more to get the PPE that people need to the front line. This is an extremely challenging situation. As you say, there's massive global demand for the equipment. This is a global pandemic. But we are trying to do everything we can to get the equipment that we need. We're trying to source more internationally. That is difficult at times. There is a great deal of demand for it, and the security of that supply can prove very challenging. But we are making progress there. And in fact, today I can report that a very large consignment of PPE is due to arrive in the UK tomorrow from Turkey, which amounts to 84 tons of PPE, and will include, for example, 400,000 gowns. So a very significant additional shipment. But demand is also very high. We are working with British manufacturers to ensure that they can make a contribution. And you've heard of some of the more prominent ones like Burberry and Barbour, but there are many SMEs as well being involved in that. And my department is also involved in trying to ensure that the supplies that we have get out not just to the NHS, critical though that is, but also to social care, often to smaller establishments like care homes all across the country. There's over 50,000 healthcare settings like that in the country, and we're using local resilience forums backed by almost 200 military planners to do the logistical task of taking the stocks that we do have and getting them to the front line. But I completely accept that this is extremely challenging. Supply in some areas, particularly gowns and certain types of masks and aprons, is in short supply at the moment, and that must be an extremely anxious time for people working on the front line. But they should be assured that we are doing everything we can to correct this issue and to get them the equipment that they need.